Back here in Accra, Ghana's response to the deadly Marburg virus is under threat as it emerges. There's a lack of awareness on the disease in the country. The virus has already claimed 2 lives, with about 98 people placed under strict surveillance by the Ghana Health Service. Although 31 have been discharged after clearance by authorities, many more people across the country have less or no knowledge about the virus. Here are some of them who spoke to Jury News earlier.
Well, I don't have any idea about the virus you are talking about, but then I think if it is here, then there has to be a need of educating people about it as well. I think if it's a virus and it's around, I'm sure it's killing people in the system, so people should be well aware of what is happening around us nowadays too. So it's here, and the COVID-2 is here as well. I think it would be good that the government educates us more about this virus.
Yeah, I'm very much aware about the new virus that is fast spreading all over. And it's a caution to everyone to be careful, just according to the conditions given regard the COVID-19 virus.
Well, I just heard it, in the news that it's killing people. But it is a task for the government to make sure that, we take this announcement serious, because, when the COVID came, it's like more or less people were advised to take, some measures in order to use the masks and other things, washing our hands regularly and all those things. But here comes the case, this one too is becoming serious, something that is killing people, and you talk of zoology and all those things, and this is a sickness that we don't know whether we have the cure for it. So as much the government is concerned, much more, education should be passed on the general public in order for us to create much awareness on this.
I haven't heard of it. I only know of corona.
I didn't hear anything about that. So I am innocent.
Which virus? I've not heard about it. I listen to the news a lot, but I've not heard about it.
Actually, I've heard of it in the news, but I did not know much about it. And then just like COVID-19 came around, and then we were much educated, and then it was all over in the news. The last one I heard was Omicron. So with the new one, I heard it in the news, but for the details, I don't know much about it.
It is today that I am really hearing about it. I actually haven't really looked at it, but I don't know why we are faced with all these challenges this time around, and I pray that our big men will try and do something about it.
Already, the Ghana Medical Association is calling for a return to the safety protocols instituted for COVID-19. Titus Bayo is the General Secretary of the Medical Association.
Based on the actions taken by the Ghana Health Service so far, I think I have confidence that the situation will be contained and we are not going to die. But we should be aware that this is a disease that has a very high fatality. And COVID doesn't come anywhere close to this. In fact, a colleague joked that this is a senior brother of Ebola. We never saw Ebola in Ghana, but we saw the devastation Ebola caused in other countries. So containment, prevention of spread is what we need to do. And for us, the general public, it's not for us to be alarmed and scared, but be vigilant.
Virologist with the Kumasi Center for Collaborative Research, Dr. Michael Owusu, is recommending an emergency sensitization campaign to boost public awareness on the virus.
For many who have come into contact with these patients, they are an observation. They are being monitored with the hope to see if any of them will manifest the signs and symptoms. If not, then of course it means that we are doing well. But then in case you have some of these experiences, then we have to raise the alert and see how best to deal with them. But the aspect of education is what is a bit on the low side because we know bushmeat animals are one of the major reservoirs of this virus. So at this level, we need a lot of education for people to understand that we are dealing with something more different than COVID. And therefore, those who are highly dependent on bushmeat and handling dead animals or processing meats for food or restaurant have to be very, very vigilant. If possible, reduce or put a brakes on some of this. I think that having some more education, especially in the local language, at these communities will be very helpful to possibly reduce further transmission in case you have the reservoirs still circulating in the community.
The World Health Organization is requesting the sharing of information among countries in West Africa. Here's country WHO Director, Dr. Francis Kasolo.
Closing of borders will not help. I think we do not advocate as the World Health Organization closing borders during outbreaks. Rather, what we need to be doing is sharing information across borders and pulling together resources to be able to heighten our surveillance, that is, the ability to detect any cases that may cross borders. I think that's the best way of addressing such an outbreak. Closing of borders does not in itself prevent the infection from crossing borders, because as we know, the borders in most of our countries are so porous that really it's an exercise in futility.
So what's the Ghana Health Service's response to this emerging health situation? I've been joined by Dr. Aboagye Da Costa, who is Head of Health Promotions at the Ghana Health Service. He joins us with more on this. Doc, I'm grateful for your time this afternoon. You just heard quite a number of people we spoke to who have no idea about the virus. Is that really a health promotion response to this?
Sorry, I'm struggling to hear you.
I'm saying that we just spoke with some people on the streets of Accra who say they have no idea about the virus. Is there any health promotion response to this?
Oh, thank you so much. So the regions where we have the case, contact tracing has actually been going on, and obviously because we are a decentralized service, the regional health directorates have actually taken charge and they are doing education in those regions. But for the national, we are also putting in place a robust nationwide awareness program, which over the weekend we worked on our strategic plan and everything. Now, we've developed some materials with what we call the frequently asked questions. We will be rolling that out, but it goes through certain approvals. So we are now going through the approvals for clearance. And once we get it, we will roll out a comprehensive campaign to educate the population. But I can assure you that this is the initial stage of the response, and the regions are taking charge for the public education in terms of, obviously, based on our structure. Mm-hmm.
Doc, so what are the implications of the obvious lack of knowledge on the fight against this virus?
Yeah, I think the most important thing is, some of the safety protocols for COVID are still relevant, and what I will encourage the population to do is to continue to wear their face masks, wash hands frequently with soap and running water, and here the social distancing is still vital if you can, and do not handle the bodies of people suspected of dying of Marburg. Yes. So with this, I think people should be vigilant, and the hygiene protocols are very, very important. But the most important thing is if you have unexplained bleeding through your eyes, nose, gum, ears, anus, and skin, please report it immediately. If you are vomiting with blood, please report it. If you have high fever, please report it. Joint and muscle pains, please do report it. And headache too. It's just a matter of being vigilant and following what the steps I've just given the population.
We are aware that 31 out of the 98 that were put under strict surveillance have been discharged. What's the condition of the remaining 67?
I think it's a matter of days. Like I said, I think it's the surveillance system continues to monitor them. And it's a regional-based, obviously, management. So once we get information from the region, aside the 31 that has been discharged, we will share.
Dr. Aboagye Da Costa, I'm grateful for your time. He's Head of Health Promotions
Thank you so
at
much.
the Ghana Health Service.